Thank you very much, Sue. So good evening, everyone. Yes, as Sue said, I've been an AIMS volunteer for the past 5 years. And previous to that, I completed a PhD looking at women's experiences of maternity care in the northwest of England. And I have 4 children myself. So as Sue said, usually I'm to be found on the other side of the screen as an attentive watcher of these sessions. And my family all know that Wednesday night is midwifery hour and that there's little that comes in its way. So if you don't know AIMS, we're a small service user-led charity in the UK that seeks to play our part in the challenge that is maternity service improvement. Next slide, please. But where are we all this year? How are we all? Well, I think for me, the word that sums it up that I heard used by a colleague and friend just this week is knackered. For non-English speakers amongst us, well, what's knackered? I guess just very exhausted. Maybe not all of us, all of the time, but there just seems to be a knackeredness about the system, an intense exhaustion. But just who is knackered? Many frontline healthcare professionals, our midwives, our doctors, our maternity care workers and others. Yes, we hear about those a lot. But also our students, our lecturers, our researchers, those in systems leadership roles, and also third sector staff and volunteers and service users too. And the trouble with being knackered, of course, is that it's hard to keep our eyes on the big picture whilst we struggle to get through the day and then the next day and the next. Next slide, please. So as Sue was saying, there's certainly been a lot going on this year. And whilst we celebrate the wealth of positive actions aimed at improving maternity experiences and outcomes, it sometimes just felt a bit too much. New initiatives, asks and directives at every turn. It feels a bit like the constantly overflowing porridge pot of the folk tale. Well-intentioned and initially tasty and even welcome. But when we're wading around in tons of this stuff, it just becomes unpalatable. And this is dangerous. This is dangerous because while we're wading around in the porridge overflow or the initiative overload, it becomes easy to lose sight of the bigger picture. And at AIMS, we are also wading through those constant demands of the overflowing porridge pot. But we're determined to keep focused on the need for structural change because we firmly believe that tinkering around the edges of our maternity services will not solve the deep-rooted problems that have been negatively affecting staff and service users alike long before the pandemic. We're calling for fundamental change, not least a reconfiguration of the service so that it's founded on relational care, so midwives can do their best, can give of their best. This is change, though, that needs to be implemented oh so sensitively. And it needs to be appetizing enough to bring people along with us. Maybe a bit more like this more appetizing bowl of muesli than streets full of sticky, cold porridge. Next slide, please. So what can all help us all be our best, do our best? There seems to be a common desire to get it right on the part of staff and service users alike. But making progress is so often fraught with difficulties, and sometimes, quite frankly, it feels that we're going backwards rather than forwards. And at AIMS, I think we think that collaboration is always going to be hard in a system under pressure. There's a lot of fear and mistrust, but focusing on some key issues can help. And I'm sorry if these words are too small on my slide, but first of all, vision. What do we want and why? What is our common purpose? We won't all agree on everything, and that's okay, but let's focus on areas of agreement. And I think as we work together on those, we can at the same time build trust, build relationships, and build our understanding of areas of disagreement. And maybe those areas of disagreement aren't as insurmountable as they first appear. Secondly, what's the word I've got there? Ground rules, yeah. The rules of engagement. Achieving our shared vision demands that we work together. But of course, we all work in different ways. So understanding how best we can interact with each other and think about problems together is key. Again, this is not easy. We need to build trust. That's just so important, and takes a level of respect for each other that can be so hard to achieve, especially when that trust is broken. And finally, community, where we understand ourselves as part of a diverse and dynamic maternity services improvement community, where we each have our part to play. Working together becomes easier. And for me, this maternity and midwifery hour is firmly established as a key component of our community. Thanks very much to Sue and for the whole team for creating what I think is becoming such a wonderful space for sharing ideas, for learning and for dialogue. I never know what I'm going to learn from one Wednesday to the next. It's really quite fabulous. Next slide, please. But it would be remiss of me not to take this opportunity to mention too the AIMS campaigns team Christmas wish list for 2023, if you will indulge me. And I hope it's not a controversial wish list, and we refresh it every year. So here goes. We want the maternity services to keep everyone safe, staff as well as service users. To offer full pathway relationship-based care. And we understand that that's a big ask and it will take some time to achieve. We want maternity services to respect our autonomy and which are increasingly physiology informed. And I'd be pleased to know how everyone else's wish list compares to ours. Next and final slide, please. So all that remains for me is to pass on the heartfelt thanks of the AIMS campaigns team to everyone for their efforts this year, including the Midwifery Forum team, Maternity and Midwifery Forum team. We hope that all of our colleagues across the maternity service improvement community manage to get a good break over the holiday period, if at all possible. And we look forward to continuing to work with you in 2023. Thank you very much. Thank you, Sue, for having me tonight.